In this episode of our clinical series podcast, we will be discussing about the work-related stress and how it affects the health and well-being of healthcare professionals. I will be focusing mainly on the occupational stress among nurses. This work-related stress among nurses can lead to burnout. Work-related stress can endanger the physical and mental health of nurses, decrease energy and work efficiency that can lead to poor patient care. It is important to identify what are the main stressors in the workplace. The following are the most common stressors that the nurses encounter in the workplace, be it in the hospital or in a long-term care facilities. Number 1 is the work overload. Nurses usually experience this when they are understaffed, where they have to cover extra workload. They have too much things to do in a limited time frame and not able to finish their assigned task on time. Number 2 is the time pressure imposed on their work. Nurses are under tremendous pressure when they need to beat the deadline. Although nurses are used to prioritize their work, the amount of work to be done is overwhelming because they have no enough time to complete their assigned task. Number 3 is the lack of social support, particularly from the higher up or from the colleagues, supervisors, as well as from the management itself. Number 4 is the exposure to infectious diseases. Since nurses are on the front line, the risk of contracting the disease is very high. At the height of the COVID pandemic outbreak, the nurses and the doctors were the first one to get sick, and some of them even succumbed to death. Number 5 is the needle stick injury. This is a common occurrence among nurses administering parenteral medications, exposing them from contaminated blood. There are a lot of blood-borne diseases that are hazardous when one is exposed, including AIDS or acquired immune deficiency syndrome, and hepatitis B infection, among others. Number 6 is sleep deprivation. Nurses work for long hours, from 8 to 12 hours or even more. Due to understaffing, they are pressured to pick up overtime shift. Number 7 is the role ambiguity and conflicts. This means that their roles are not clear-cut and confusing, causing conflict in the workplace. Number 7 is the understaffing, which is one of the main problems in our health system today because of the shortage of trained and experienced nurses. This can lead to work overload that could contribute further to the stress. This can lead to both physical and emotional exhaustion that would affect the overall health and well-being of nurses. Number 8 is dealing with difficult or critically ill patient. Although it is the nature of the nursing job, it is still stressful to be at the middle of the situation day in and day out. Number 9 is the bullying and violence in the workplace. Nurses can become a victim of aggressive and violent behaviors and also can be subjected to bullying in the workplace. The emotional abuse can affect the mental health of the nurses for a long time. As a nurse, your job is critical because patients rely on you. So it is incumbent upon you to take care of yourself in order to take care of others, particularly your patients, family, and friends. Workplace stress can affect and derail your job performance. What are the common effects of stress? Stress symptoms can affect your body, your thoughts and feelings, and your behavior. Being able to recognize common stress symptoms can help you manage them. Stress that is left unchecked can contribute to many health problems, such as high blood pressure, heart disease, obesity, and diabetes. The common effect of stress in your body includes headache, muscle tension or pain, chest pain, fatigue, change in sex drive, and upset stomach. It also affects your mood, and it would manifest as anxiety, restlessness, lack of motivation or focus, feeling overwhelmed, irritability or anger, and sadness or depression. At the same time, it also affects your behavior as exhibited by overeating or undereating, angry outbursts, drug or alcohol misuse, tobacco use, social withdrawal, and exercise is less often. How can one manage stress? If you have a stress symptoms, taking steps to manage your stress have many health benefits. Try to explore the following stress management strategies. Number 1 is getting regular physical activity. Number 2 is practicing relaxation techniques, such as deep breathing, meditation, yoga, tai chi, or massage. Number 3 keeping a good sense of humor. Number 4 is spending time with family and friends. And number 5 setting aside time for hobbies, such as reading a book or listening to music. You should find a way to actively manage your stress. Inactive ways to manage stress include watching television, surfing the internet, or playing video games may seem relaxing, but they may increase your stress over the long term. Be sure to get plenty of sleep and eat a healthy and balanced diet. Avoid tobacco use, excessive caffeine and alcohol, and the use of illegal substances. When is the time to seek help? If you're not sure if stress is the cause or if you have taken steps to control your stress, but your symptoms persist, see your doctor. Your healthcare